All right, hi everyone. I want to introduce you guys to this phenomenal woman who is my cousin. And she has been a nurse for about 13 years, and then her background in child care, daycare has been about 28 years. How long has it been? A long
About
time.
21 years.
21 years and a nurse for 13 years. So she has a lot of information that we can learn about, COVID, and also anything that we can be where in terms of our kids. So she's also a mother of two twins, because she's a twin too, but she has twins, one set of twins they're 8, right? 8 years old. And so she has a lot of background. And I just wanted to.
They are 9.
They're 9. Ooh, sorry. So I wanted to just bring her in and just kind of get her perspective about childcare safety and also COVID-19. So how have you been during this whole COVID-19 time, being a nurse and a mom?
I've been hanging in there. We faced many challenges as working on the front line with COVID. Something they don't really teach you in nursing school is how to deal with a pandemic, because nobody is really prepared for a pandemic. So we kind of just took each day by day, and we're working through it. They offer many resources for nurses who are going through some pandemic anxiety or stress, depression, which I am grateful for, because we are human beings. Even though we're nurses, we're still human beings. But they have been looking out for us. But overall, I've been doing good. I've been doing great. The first wave was the inevitable, because we didn't know what to expect. Now we're into our second wave now, and it's a little bit better. The mortality rate has gone down, and we have new treatment now. So, we're working through it.
Yeah, and how are you doing it, balancing being a mom and, dealing with this pandemic, dealing with your own mental health, and also...
Hello? Did you freeze?
Oh, are you still? Oh, I must have fret. Okay. So my question was, how are you dealing with the balance between working with this, virus, and then coming home to your two kids and also your husband too? Like, how are you balancing all of that?
Well, now that we know more about the virus, I still take the extra precautions as far as coming home, totally getting undressed and going straight to the bathroom and taking a shower, that kind of thing. Always educating my family as far as wearing a mask and washing their hands as well. And really, the COVID has changed a lot in everybody's life, as far as virtual with the kids. We have to make adjustments in the life. My job was really supportive of that. So I ended up switching to weekend program, just so I can be home with my kids through virtual. And they go to daycare one day out the week. Which, you can be exposed to COVID anytime, but it's a chance we take because mom still has to work.
Yeah. So how has that been? Because I know your mom owns a daycare. So what is the protocol that you guys have been doing over there with the daycare?
So with us having a family-owned business for over 21 years, I have progressed, and my mother has actually made me in charge from a medical nursing standpoint of creating policies. One thing that the government wanted us to do was, or actually the state of Wisconsin wanted us to do to make a policy on how we were kind of dealing with COVID and what precautions we were going to be taking as far as with the kids. Which everything that I do, I recommend or go by the CDC and their recommendations. And that's what we follow at the daycare center. So with me being in charge of like the health and policies at the daycare center, I just kind of went over with what the CDC was saying, and kind of took extra precautions over what the CDC is saying. So one of the things that I had to do as far as my mom's daycare center policy is create a COVID policy. So for us to take precaution, each child that comes into the daycare center, they go straight to the bathroom to wash their hands or the washing sink. They have to wash their hands and we check temperatures. Also, if you are preschool or up, 3-4 years old and up, you are required to wear a mask inside the daycare center as well as the staff. Parents are not allowed at the center. We actually have them stop at the door, the foyer, and drop their kids off, and then we'll take the kids in. If anybody wanted to come in to tour the facilities, they would need a mask and they would need their temperatures checked, and they will also have to wash their hands as well. We do have a strict policy because we want to remain open and, we just want to be able to provide that business to the parents who need to go to work. So we keep a strict policy, which a lot of parents really don't like, but, it's safety first. So one of the examples of a strict policy that we created, if your family goes out of town, they do have to stay home and quarantine for 14 days before coming back to the daycare. If they go to a large gathering, and we know about it, they have to stay home for 14 days because we want to keep COVID out of the center, and we just want to be cautious. As far as any visitors, like if we have packages dropped off or anything, that too, they would have to wear a mask to come in to the facility. And that's pretty much it. Hand washing, parents wearing masks, staff definitely wearing masks. Also, this goes for the staff as well. If they're going out of town on a vacation, if they have large gatherings, they have to quarantine for 14 days.
I like that. I like that stretch. And that's really, that's following the CDC guidelines of the gatherings and really making people require them to implement that into their daily life to really help the kids. So what do you guys do, or if you guys have came across like a positive case of COVID?
So in our policy, if actually we did have a parent test positive, the child could no longer come back to the center until he was cleared by the doctor. And also the parent would have to test negative in order for the child to come back. The child will also have to quarantine for 14 days with symptoms. If they don't have any symptoms within those 14 days, they're able to come back. If they do, then we require for the child to get tested as well.
Okay. Oh, that's great. Do you guys have like a capacity rule of so many kids or something like that? Well, I know the daycare already has the guidelines, but are the rooms smaller, or what is there a different guideline with that?
So initially when the first shutdown happened in March, the governor allowed for daycare centers with the capacity of 50 or less to still operate. And if you were over 50, you had to minimize your children. And that's hard to say who you're not going to, be able to to the daycare. But with us, we are under 50. We're actually licensed for 40 children. And also if you have a staff member over 10 staff members in the facility, you will have to eliminate your staff. So we were lucky because we're licensed for 40. We have 9 teachers actually.
Oh, wow. Right.
So we just made the cut. So we remained open, but we had to abide by strict guidelines for that. And as far as positive COVID tests, if one of our teachers tested positive, then we would shut the daycare down for 14 days.
Oh, okay.
Yeah.
Okay. Well, that is really good information. I'll be sharing this on, my Facebook page, also the COVID-19 African American Social Influence page, just so people can be aware, just to have another resource. And I'm so glad that I have you as a resource, and that you guys are doing this amazing work during this time. You've been on the front line. Your mom, your sister. You guys have been working through it and really providing the services that we really need for our community, and especially our Black community, where we have that, those leaderships. And I really want to thank you for your time. And anything else you want to share to our African American community during this time, like any encouragement or anything that you think they should be doing to help them through this?
I just want to say we all in this together. In order for us to contain this virus, we need to just go by the guidelines. Wear your mask, wash your hands, small gatherings. If you do not have to go out of town, don't go out of town. If you do, wear your mask, take extra precaution, and it is real.
It is real. It is real. Yes. Let's stay safe, everybody. Let's be smart, and let's do this together. Let's stay well. Let's stay well. But thank you so much, Jeanette, for your time and energy. And
You're welcome.
I don't really know how to start recording this, but you guys, wait, let me see.